In this video, it's going to be an Ask Me Anything kind of video. You sent in questions, you sent in comments, and here are some replies. So hang in there, wait till the end of the video where I give some themes that I'm seeing in the questions. And as always, thank you for your questions and comments. Hi, I'm Dr. Eric Westman, and welcome to my channel where I review and debunk nutritional information online. I've been struggling with high blood sugar for about 10 years, labeled pre-diabetic, but trying to change through lifestyle. I've yo-yoed up and down. My last A1C was 5.7. Recently, I started using a continuous glucose monitor and discovered that my fasting blood sugar rarely goes below 105, even with an extended fast of 16 to 20 hours. It usually averages 112 or so, often increasing to 120 to 128 when I exercise. My question: I've been dedicated to keto for a little over 2 months and still blood sugar is high. It rarely goes above 140, but rarely goes below 105 either. Has my yo-yo dieting over the years destroyed my chance to heal my body? Well, thank you for this question. It's a common theme of please be patient. If you've just started onto a keto, carnivore, low-carb diet, or any healthy diet compared to the standard American diet, it takes time to normalize the blood sugars. Some people, it is overnight, but for most people, it takes months, maybe even years, to normalize the blood sugar into the 80 and 90 range. That's milligrams per deciliter. So it's fantastic that your A1C, hemoglobin A1C, is a measure of 3 months of the blood sugars. It's great that it was 5.7, which is in the normal range. A continuous glucose monitor, or CGM, is a little disc that you can put on the arm or body, and it measures your blood sugar every 5 minutes without any finger sticks, any kind of blood meter use like you used to have to do in the past. I think it's a great tool, but I don't want you to be too obsessed over the blood sugars. They do go up and down, and to be under 120 and 128 when you exercise is fantastic, because here's one of the things that you need to learn when you get a glucose monitor. The blood sugar will go up when you exercise because your body's using more blood sugar, and so it's going to supply more to the body. But if you're really running on fat, where in the exercise, you won't be sucking down or lowering the blood sugar level as much as you would have before. So, you have to understand that there are ups and downs in the blood glucose, even when you're not eating any carbohydrates. But I think this range is just fine, and I would just continue to do what you're doing. As far as yo-yo dieting destroying the chance to heal my body, no, I don't think so. It's something that your body will figure out. Give it time. And the main thing is to be patient with that blood sugar. I'm a 55-year-old male and have severe skin issues my entire life. My problem is that I am allergic to omega-3 fatty acids, and my symptoms are life-threatening with animal and plant sources. I currently eat a ketovore diet after being a carnivore for 4 years and keto for 15 years without any changes with said allergy. Thank you for this opportunity. Well, not to worry, an allergy to any kind of supplement is not a deal breaker because I don't want you to have supplements. So there are many approaches out there in the keto-verse, the internet, and I prefer an approach that has real food as the basis, and you don't need to take supplements like a lot of the influencers out there say you do. So ketovore and carnivore, low carb, all of these are healthy approaches, and I wouldn't worry about an allergy to a vitamin or a supplement like that because you really don't need them. So keep it up. Dr. Westman, what are the best clinical trials or evidence-based studies to show other physicians that are skeptical about low-carb benefits? How best to be able to work with other doctors that are lifestyle med docs or very much on the plant-based diet thinking without burning bridges or creating rifts? Asking a family medicine physician sharing low-carb with my patients. Well, thank you. And it's great to hear a question from a doctor. I'm a doctor, and 25 years ago, I had to learn this for the first time. And I learned it through my patients who are following an approach by reading books, which is always reassuring to me because I realize that you're really in charge of picking and choosing the food or the medicine food. Food is medicine if you get it right. So you don't need a doctor to prescribe you a pill or a shot. You can use food as your medicine. So I think the best evidence now is in a book. It's a textbook. It's a yellow and white book with an egg on the front of it. It's called Ketogenic: The Science Behind Therapeutic Carbohydrate Restriction in Humans. It's a textbook that came out, I would say, 2 years ago now, and it's about $100. You get it at any bookseller. It's a textbook about low carb and keto diets, and it's an edited textbook with contributors from around the world. I contributed chapters on diabetes and obesity and on basic low carb nutrition. So now, as a doctor, you might not want to send everyone a textbook. You might actually want a specific reference. I understand. There are now so many references on low carb keto diets. Where do you begin? So depending on the time you have, if I'm in a clinic room with someone trying to convince them and they're a doctor, I simply go to the PubMed website, the database where all of the science is. And if that person understands PubMed, it's also used to be called Medline. I type in my name, Westman space EC, and I press enter. And I show the data that I've helped to accumulate through the years in peer review form. Then I type in Yancey space US Jr., and then all of the papers that my colleague Will Yancey has published on low carb diets comes up in that database. If someone needs information on PCOS, heartburn, diabetes, obesity, I'll pull out those specific references with my name or Will Yancey's name on it. That's probably the best way to specifically get the scientific sources. Look up the authors that contributed the seminal papers, if you will. Dr. Yancey's first paper, randomized trial, was published in 2002. There are meta-analyses of randomized trials, meaning studies of studies. I think there are 5 of them now, and on diabetes and low carb diets for obesity. So the data are out there. It's almost now too much. So the book, textbook, going to PubMed, searching my name and Will Yancey's name. Finally, if someone just needs a book to follow, I would recommend my latest book called End Your Carb Confusion. It actually got an award at a keto meeting recently. It was one of the best books of the year. So End Your Carb Confusion, if you want to just give a source of information that's evidence-based as well. I want to personally invite you to take a closer look at what the carnivore diet can do for you. If you've already tried low carb or keto, but still struggle with fatigue, inflammation, digestive issues, or autoimmune symptoms, this could be the reset your body needs. Inside, you'll learn why plant foods might be triggering your symptoms, how carnivore works as the ultimate elimination diet, and what makes this approach so powerful for healing and restoring your health. Sign up to get my carnivore free guide below. Thank you for the opportunity, Dr. Westman. How can I deal with undereating on carnivore? I've developed a very small hunger and appetite since I began, and I'm certain that I need to eat more. Some days I'll not even eat 100 grams of meat and an egg. Plenty of water though. Well, thank you for the question. And how do you know you're undereating? The longer I go following this kind of approach and seeing other people follow this approach and follow the science of nutrition and longevity, the more I'm learning that the animals and even humans live longer if you eat less, not more. So it really depends on the context, and that's going to be a major theme that I'll just have to keep hammering away each time. So if you're young, healthy, you're active, you're in the gym, and you're not feeling like you have enough energy, you might need to eat more. If you're older, like me, if you're not in the gym every day like me, then you don't want to be eating as much as everyone says you need to eat. And you don't want to follow an app to say, you need more protein, or you don't need to follow what your spouse or neighbors or even your family doctor or internist says these days. I'm impressed that as time goes on, we're learning the benefits of eating less, not more. Haven't you seen that? The idea that intermittent fasting, where you have a time of day where you're not eating, or even total fasting, these are ideas that actually give your body a chance to heal itself when you're not eating so much or so frequently, not eating all the time. So I guess I'd push back and kind of say, how do you know you're under eating? And that determination would be something I make in the clinic, depending on how you're feeling, whether you're able to do what you want to do, how does the blood work look. So thanks for the question. It's a common one. Hi, Dr. Westman. I'm currently 24 weeks pregnant, and I'm wondering if it's okay to switch to keto mid-pregnancy. I already eat lower carb than the standard American diet, around 100 grams of carbs a day. And I'm wondering if it's okay to progressively lower my carbs over a couple of weeks. I get migraines, brain fog, and upset stomach whenever I eat any carbs besides broccoli or cauliflower. And I just want to feel better and have a healthy baby. There's so much information out there against keto in pregnancy, and it's hard not to be deterred by that. I know those studies are probably all actually about starvation ketosis and not nutritional ketosis, but it still makes me a little nervous. I know you have a video about keto in pregnancy already, and it's wonderful. I just wasn't sure if it's okay to switch to keto while already pregnant. Thank you for your time. Well, of all of the areas in medicine that we are, how should I say, a little skittish about, like you are, is pregnancy. Skittish meaning you want evidence and hopefully clinical studies before you give recommendations in that particular area, because nobody wants to mess up a healthy pregnancy. So, kind of my clinical hat would be, don't mess with success and just keep doing what you're doing. If you're eating carbs, you don't have a diagnosis of pregnancy diabetes, the gestational diabetes is the technical term, don't rock the boat and maybe keto adapt before the next pregnancy. Now, the reason I say it might be okay if you to keto adapt prior and then get pregnant is there are a lot of people who have already done that. Now, it's not in clinical trials. It's a grassroots movement that we're watching happen, meaning people do it, they tell their results. A group called Type 1 Grit, where these people have type 1 diabetes. Many of them have become pregnant and had keto babies. I visited Indonesia, and the doctors there were telling me that they have a lot of people who are keto mothers and then have keto babies, and then they even progress really well without carbs as they grow as a child. But that said, in the US and in, I guess, everywhere in the world, we have a particular skittish approach, meaning we're very cautious about making recommendations in the world of OBGYN and pregnancy. That said, I wouldn't change anything right now, but maybe the next time. G'day, I've been on the carnivore diet coming up to a year. It's going really well, and I have many health benefits. However, I'm constantly worried about getting kidney stones. I'm a 59-year-old male. Should I be worried? Well, I want to relieve worry. If you haven't had kidney stones yet, that's probably the most important history. The kidney stone development in any kind of diet typically happens because of dehydration. And it can happen early on in a diet change if you're not keeping up with fluids, you're not drinking salt and getting electrolytes early on. So I don't worry about kidney stones. I see them from time to time, just like people on any kind of diet can get kidney stones. Typically, the way to prevent them is drinking plenty of fluid, keeping the kidney urine flowing so the stones don't get a chance to form. There are some specific conditions, if you have recurrent kidney stones, where most of the kidney specialists in my area will ask or prescribe a nutritional supplement called potassium citrate, and that changes the pH and the quality of the urine so that you're less likely to get kidney stones. That's typically reserved for people who've already had one, so I wouldn't worry about it. Stay hydrated and you'll probably be fine. Is keto really harmful in the long run for the thyroid? Not that I'm aware of. So yes, there's a lot of internet noise about this. Do the blood levels change? Possibly. Do you have to change the thyroid supplementation after a while if you've lost a lot of weight or you're changing the metabolism to a fat-burning condition? Maybe. So like any kind of dietary change or weight loss program, you're going to want to measure the thyroid, measure how you feel, and in most, well, pretty much all the cases, there's a way to adjust if you're wanting to continue this, and I don't see any evidence that it's harmful for the thyroid. Is there a medical ketogenic diet for the mentally ill or a different one for other issues? Yes. So how the keto diet is taught can depend on the condition that it's being used for. Classically, 150 years ago, kind of like the keto diet for diabetes and obesity, there's a keto diet for childhood epilepsy, really now adult epilepsy too. So that there was a different doctor, a different area who figured out that going on the history that starving or fasting could be helpful for seizures, figured out that a keto metabolism, not eating carbs and doing it very strictly, could actually cure or fix or reverse childhood epilepsy. It's not in everyone, but most children have some improvement if they change to a keto diet if they have childhood epilepsy. Some children have total resolution of the seizures. So that diet is very strict. And you may even want to check ketones with blood, breath, or urine if you're using a keto diet for epilepsy. The reason I started with the epilepsy is that that's a brain issue, right? So now there's all this research being started on using a keto diet for mental health problems. There's a new initiative with nice funding to get this started and raise awareness about keto diets and mental health issues. And under that circumstance, yes, you might want to be very strict, measure ketones, breath, blood, or urine. There's another growing area of science which is related to cancer treatments. And in this situation, you may want to check blood or breath or urine ketones if you're using keto for cancer treatments. If you're using keto for diabetes reversal, other metabolic issues, weight loss, PCOS reversal, prediabetes reversal, you don't have to measure ketones. You don't have to be that strict. It can be more informal and still have tremendous benefits. So thanks for the question. There are different types of keto diets depending on what condition that you're treating. This is my first Ask Me Anything of the comments and questions on the videos below. Keep them coming and let me know what you thought about this one. I'd like to be able to answer your question. Let me know in the description below. If you like this, please like, subscribe, and ring the notification bell so you don't miss out on new content on Wednesdays and Fridays. If you enjoyed this video, consider joining our YouTube membership for early access and exclusive live Q&As with me. Just click the Join button below or support us with a PayPal in the description.